Good afternoon, ladies and gentlemen, and welcome everyone. I hope that whether you're joining us virtually or you are here with us in Barcelona face-to-face, I hope that you enjoyed the past 4 days of learning, networking, and knowledge exchange. This is the first post-pandemic Congress, so I'm very, very proud that Barcelona and Catalonia has hosted the top world leaders in health for 4 days. We have a very, very exciting closing plenary session today. And to lead this important discussion, let me welcome and leave the word to the President and CEO of the American College of Healthcare Executive and incoming President of the International Hospital Federation, Deborah Bowen.
Hello, thank you, Helena. Thank you. It's great to see all of you, and we're very excited to have this time with you during this time. So let me tell you a little bit about how we're going to spend our time. First of all, we have our distinguished guests who we will hear from, and I will introduce them. Obviously, the Minister of Health from Catalan. We're very pleased to have you here, Dr. Argimon, and obviously His Excellency Mr. Awadh Ketbi. We're very honored to have you here as the Director General of the Dubai Health Authority. So we're also going to have a little discussion about collaboration and the importance of collaboration and what we're learning about collaboration, not only as we navigated through COVID, but how events like this can really help us advance healthcare. So, but first, we have a special treat for you, and we're going to hear from Zsuzsanna Jakab, who's the Deputy Director of the World Health Organization. You know, for those of you who know Dr. Jakab, she has done many, many things. She was the WHO Regional Director for the European region for 9 years before she was appointed in March of 2019 to the Deputy Director role. She has had many high-profile roles, and she has a very big job. She's not only in charge of the technical programs, but also she is in charge of universal health coverage. She's in charge of communicable and non-communicable diseases, healthier populations, to only name a few. So if we can, let's hear from Dr. Jakab.
Dear colleagues, I am very happy to be with you today at this 44th Ihf World Hospital Congress. The COVID pandemic has been a terrible shock to the world's population. It has shaken the foundations of our societies and our health systems. Through it all, hospitals have been at the front line of the response. We have witnessed hospital staff worldwide courageously and professionally dedicating themselves to taking care of patients. Health workers have faced extreme challenges, both professional and personal, and physical and psychological. They have been subjected to extraordinary levels of stress, exposed to high-demand settings for long hours, lived in constant fear of disease exposure while separated from family, and face social stigmatization. A WHO study recently highlighted an alarming rise in reports of verbal harassment, discrimination, and physical violence among health workers in the wake of COVID-19. And sadly, more than 100,000 have died from COVID-19 since January 2020. Our condolences go to all families and colleagues of these victims of COVID-19. And to all of you, as many of these courageous workers were colleagues of yours. I am happy to say that very recently the Steering Committee for the International Year of Health and Care Workers in 2021 issued a joint statement for immediate and concrete action to protect health and care workers from the impact of the pandemic. Any visit to a hospital as a patient or as a visitor reminds us how hospitals are extraordinary organizations optimized to deliver the best quality of care to those in need. The pandemic has demonstrated at global scale and in an unprecedented manner the agility and responsiveness of many hospitals. But it has also highlighted the significant work still required to make our hospitals fully fit for purpose, able to cope with crises, and able to protect the well-being of the health workforce. To achieve this, we count on our close collaboration with the IHF and its large community of expertise. I would like to propose 3 concrete next steps. First, we have to learn the lessons from the pandemic. This pandemic put a stark light on the terrible consequences of underinvestment, policy inaction, or on poor policy choices made over the last decades. We need to seize the opportunity for comprehensive and systemic improvement. We need to promote and replicate proven innovations, including digital technologies. We need to promote governance and financing mechanisms for greater responsiveness to population needs and integrated service delivery with a public health perspective. We need to celebrate the success of many hospitals during the pandemic and identify the success factors. We would be pleased to learn from you and make sure your observations are shared through our WHO COVID-19 Health Services Learning Hub. Second, we must ensure that hospitals receive more attention. Globally, 81 countries have fewer than 18 hospital beds for every 10,000 people, and among them, 17 countries have less than 5 beds per 10,000 population, well below the minimum threshold needed to achieve the Sustainable Development Goals. In low and middle-income countries, more than a third of surgical hospitals lacks a reliable water source, continuous electricity, or a generator. The global need for surgical and anesthesia services greatly outstrips their availability, and the capacity of primary care to provide timely, accurate, and appropriate referral is essential to optimal use of this scarce resource. While scaling up buildings and infrastructure will be necessary, priority should be given to transforming what hospitals do and how they do it in order to deliver quality care to those they serve. As you know well, up to 8.4 million deaths are attributed to poor quality care each year in low and middle-income countries, which represents up to 15% of overall deaths in these countries. Hospitals are critical to building optimal health systems and should be fully interconnected with the rest of the health and social care system and wider society. Integrated, people-centered service delivery must include emergency, critical, and operative care services that are linked to communities through primary care and by communication, transportation, referral, and counter-referral mechanism. The strengthening and improved governance of hospitals will allow better allocation of resources as well as to more appropriately respond to the needs, priorities and values of the individual. Taking a population-based planning approach that accounts for the distinct and complementary capacities of these platforms, as well as their profound interdependence, can simultaneously optimize both primary and hospital-based care in order to deliver quality of care. Thirdly, hospitals must be ready for future shocks. Building health systems that can deliver on UHC and manage emergencies must be our aim. We promote a primary healthcare approach for stronger and more prepared and resilient health systems. It requires a shift from systems designed around diseases and health institutions towards health systems designed for people, with people. And hospitals are an integral part of this agenda. As an essential step, patient and community organizations should be guaranteed meaningful representation and engagement within governance structures such as hospital or district boards. It is important to invest in social participation mechanisms, as these can provide a platform for meaningful engagement and contribute to strengthening the very fabric of society, building from within the resilience needed to lift us out of the current crisis and prepare us better for future ones. At WHO, we have set an ambitious work plan to support hospital strategies within integrated health systems. We aim to establish a sound evidence base that will inform policy decisions. The WHO IHF study on hospital financing in times of COVID, presented in this Congress, is an integral part of this endeavor. At WHO, we are aware that the strength of a health system rests on the human interactions and cooperation between actors within the whole ecosystem. We will encourage our member states to pay more attention to the full universe of actors, including those from the private sector. Among other things, there is a need in many countries to establish policy platforms able to acknowledge and value the growing pluralism in our society. We look forward to collaboration with IHF and national hospital associations on this agenda, especially in low and middle-income countries, where the absence of such platforms has been a bottleneck for the response. We want to promote the engagement of hospitals with the communities they serve to co-design new ways of delivering services more responsive to people's needs across the life course, and in particular those most vulnerable, including older people. To support this, WHO is establishing hospital and health services transformation incubators. The IHF Congress next year might be an opportunity to already share the lessons from these experiences. Ladies and gentlemen, I thank you for your leadership and for facilitating this important discussion so that together we can have the strong, agile, and resilient hospitals people need.
Thank you. Very good. We thank Dr. Jakab for those great words, and we'll talk about some of the things she mentioned a little later. So next, I'd like to invite the Honorable Dr. Josep Argimon, who is the Minister of Health of Catalonia. We're very pleased to have you with us today, and we want to thank you for hosting us in this beautiful country. I know many of us have been able to get out and really appreciate all that you've done. Let me tell you a little bit about Dr. Argimon, though. He's an epidemiologist, certainly an important field right now, as it always has been. He's been the Secretary of Public Health from 2018 to 2020, but he has served many other roles, being a tireless advocate in the Director of Agency for Quality and Health Assessment, and he also was the Deputy Director for several years of the Catalan Health Service. You're relatively new to your role, I believe.
Yes,
Yes.
just have 5 months.
Yes, 5 months.
Only 5
so
months,
what a
yes.
5 months it's been. May we invite you to the podium to give your remarks?
Okay, thank you very much.
Thank you.
Good afternoon, ladies and gentlemen. First of all, I would like to thank you, the International Hospital Federation and La Unió, for their invitation in this closing session of the World Hospital Congress. I also congratulate them of the success of this Congress, which has certainly been especially fruitful meeting the challenges we currently face in the field of health, and more specifically in the field of hospital, in the hospital areas. For us, for Catalonia and for Barcelona, it has been an honor to host this Congress and become, for a few days, the world capital of health. Today, we pass the baton to Dubai as the next organizer of the World Hospital Congress. However, before that, we have the opportunity to present in this closing session the main features of our health system and the transformation challenges that it should face. As a first aspect, it should be borne in mind that the Spanish state, from the healthcare point of view, is a very decentralized state, and Catalonia has the main competencies in the field of healthcare. Thus, the Health Department of Catalonia has been responsible for the provision of public health services in its territory since 1981. In these 40 years, Catalonia has set up a public health service with universal coverage, financed in solidarity by taxes. It is, therefore, a beverage-inspired model. However, unlike other territories in Spain, the model of providing health services is mixed. This means that entities of various characteristics and ownership provide the service to the population under the umbrella of the coverage of the Catalan Health Service. A general law of health planning, la Llei d'Ordenació Sanitària de Catalunya, approved by a large majority in the Parliament of Catalonia, is what shapes this health model. A model that has its roots in the history of our country, where for centuries, civil society initiatives have emerged in charge of providing healthcare. These are hospitals and health resources of various ownerships, as I said, charities, foundations, city councils, church. To all of these, we must add the 100% publicly owned centers, which are an important part of the country's health provider, especially in primary care. But it has to be clear that the service is always public, funded and organized and planned by the health department. Another characteristic feature of our healthcare network is its proximity and territory equity. This is the case of primary care, with more than 400 healthcare centers, primary healthcare centers, and our wide hospital network. We always say that in Catalonia we have a hospital in every 30 kilometers. This is a hospital network where very close to the citizens live where they live. We have these hospitals organized in 5 main access areas so that the patients can be cared for in the center that their pathology requires, depending on their complexity. This would be a brief description of our health services, but it would not like to end without pointing out very briefly what are the main challenges we have now. Challenges that in many cases are common to other countries and health systems in the world. I will do it telegraphically so as not to be, tiring the people. And just as a summary, the first challenge is the recovery from the pandemic. We need to recover diagnoses hidden behind COVID-19 and care activity to respond to them. The second challenge is funding. This week, we present the health budget to the Parliament. It is an important step forward, but we need to be able to continue spending more money and resources on health. The third point is the integration of care resources with a central role of primary care, which more capacity to solve health problems and new professionals' profiles to respond to new needs. The hospital network also needs to be more integrated with less fragmentation and more shared services. Another challenge is the integration of social and health services to respond to a more aged and dependent population. Also, mental health, it needs more funding. It has to be closer, do more prevention, and be better adapted to people's needs, especially children and young people. Public health. The pandemic has shown that we need to strengthen its structures with special emphasis on epidemiologic surveillance and better integration with other healthcare resources. Finally, we need to respond to the needs of professionals are very stressed after pandemics. We have to improve their conditions, and we have to find solutions to the lack of certain specialties and professional profiles. So, without going any further, I wanted it to be my contribution today from the point of view of Catalonia. Thank you very much.
Thank you very much. Thank you, Dr. Argimon. Very, very good. So let's continue on, and then we'll have our discussion. So we have the honor today of also having with us His Excellency Awadh Ketbi, who is appointed to the Director General role of the Dubai Health Authority in January. Is that correct?
Yeah,
yeah,
absolutely.
January. So currently he's a member of the Executive Council of the Dubai government, Chairman of the Dubai Corporation of Ambulance Services, Chairman of the Dubai Future Council for Health and Well-being, and member of the Board of Directors of the Dubai Academic Health Corporation, as well as many other roles. I have a long list of roles here. You are obviously a very distinguished individual. So he obviously has a comprehensive understanding of the UAE, and we're very, very honored to have you here today. May I invite you to the podium to give your remarks?
Thank you. Thank you. As Secretary, I wasn't going to share with you, but I've already started lobbying with the President, Ron, and some of my colleagues to make the conference more enjoyable in Dubai and have more time to yourselves. So you go out, you spend your money, you enjoy the city, you have fun. It's our time to have fun. For the last 2 years, you've been frontliners, and you've been doing a lot. And I've seen some of you. So let's enjoy Dubai, hopefully soon. Distinguished guests, ladies and gentlemen, it's an honor to be here today at the 44th Ihf Hospital Congress, which has established itself as a global platform to bring together the very best minds in healthcare from around the world. This platform provides an opportunity for healthcare professionals and policymakers to brainstorm and exchange knowledge to advance healthcare. We can all agree it is a relief to see the world going back to the norms, and life is going back to usual after the pandemic where we meet. In Dubai currently, we have the ongoing Expo 2020. It is the largest human gathering of expertise, ideas, cultures, and achievements. The 8-year preparation for the largest global event that will last for the 6 coming months, with the participation of more than 190 countries, represent the international trust in our country. It demonstrates our ability to host the largest conventions, conferences, and gatherings, and represent our values of cooperation, tolerance, and peace. In January 22, we will have the pleasure to host the 47th edition of the Arab Health. This conference began its journey in Dubai, and today it's one of the largest, if it's not the largest, healthcare conference and exhibition in the world. I'd like to take this moment to express my deepest gratitude to the healthcare community, globally and in UAE, for they have been frontliners in our fight against COVID-19. Let's salute them, please. COVID-19 is a global challenge. We managed to minimize the number of deaths and infections by scaling up our services, PCR testing, and ensuring that every person in the country who is eligible on medical grounds is vaccinated. Globally, the UAE has the highest number of people being vaccinated. Above 91% at least took 1 dose of vaccine, and above 82% took 2 doses of vaccine. All these measures ensured that Dubai and UAE did not face a lockdown we had. Sterilization drive that lasted for 4 weeks only. We are deeply grateful to our wise leadership for their support and guidance that helped us achieve this despite the mounting challenges. We are incredibly proud that we shall host the prestigious 45th Ihf Congress in Dubai in November 2022, under the theme Achieving Sustainability and How Should We Look in 2030. This is the second time this prestigious conference will take place in Dubai. Previously, the 37th edition of IHF took place in 2011 in Dubai. This reflects the trust in Dubai's capability to host the world-class events. I look forward to welcoming you to Dubai next year. November is a pleasant time to visit Dubai, by the way. I wish you the very best, and I welcome you all to Dubai for the 45th IHF Congress. Thank you.
Great, thank you. Thank you. I like the idea of having fun. I like that. I mean, I listened to many other things in your speech, but that's a good spirit, I think. Let's talk a little bit about international collaborations, because certainly we have a beautiful laboratory here of all the great things that we can do together. So how does, let's start with you, Dr. Argimon. How does the international collaboration fit into your plans? What are you thinking about, and what are your priorities?
International collaboration is always in our strategic plans, and this kind of collaboration is framed in the programs of European Union about cooperation between state members and also at the regional level. And of course, international cooperation is open with other countries around the world.
Yeah. How about for you, Mr. Awadh?
I think it happens naturally.
Yeah.
We do plan for it, and we do put it in our strategies. But it's also there.
Yeah.
If you see, I'm sure somebody right now in Dubai talking to someone in Barcelona or someone in Korea, Seoul, talking about different things. So it happens naturally. It happens by gatherings. It happens when we meet each other, when we discuss challenges, issues, opportunities, and so on. And I think, yes, we have it in our themes, international guidance, and we have it in our strategies, we have it in our embassies, but it's also there as a natural thing that happens with humans. You know.
I am always struck by the amount of similarity there are in the issues that we think about and the issues that we talk about. So, you know, I'm thinking about future models of care, sustainability, innovations, digital. We all have the same things in mind. And I think to the extent that we can learn from each other, it's really, really helpful. So do you have an example? I mean, is there one collaboration that sort of sticks out in your mind as something that was either particularly relevant during COVID or something that was perhaps a little unexpected?
Well, a lot of experiences, a lot of examples, and as you said, it happens naturally. For instance, the Hospital of Catalonia had historically a long tradition of relation with foreign hospitals around the world, and this is a link an old link to keep in contact people, clinical specialists, and also managers and so forth. So as you said, I think it happens naturally. There are a lot of examples. I couldn't think now in just one example, but I mean a lot.
Yeah. You know, in the United States, you know, obviously we don't have a lot of the cross-border kinds of things. Obviously, you do. I mean, we think cross-border is going to Wisconsin from Illinois or things like that. So, you know, in our world, it sort of happens system to system, or sometimes individual hospital to individual hospital.
It happens also system to system, and of course, in the European Union, there are these cross-border collaboration. And we have a unique example in Europe that is l'Hospital Transfrontalier. It's an hospital located in the mountains of Pyrenees, in the Pyrenees Mountains. And it's a full-equipped hospital that works both for French people and for Catalan people. It's run by French people and Catalan people, and healthcare workers are French and Catalan. It's a unique case in Europe as a Hospital Transfrontalier, and you are invited both to visit the hospital. It's a very
Thank you.
very special.
We might take you up on that, right? How about for you? Are there particular examples of collaborations that you're particularly proud of or know of that have really come to top of mind?
Yes, absolutely. I mean, especially during COVID. One of the examples is when the Chinese government has agreed to give United Arab Emirates government the chance to have a good of their production of the vaccine. And we actually tried it in United Arab Emirates. we've tried it on 50 people who have agreed to go through the trial, and 50,000 people, and appeared to be successful, and we've actually implemented them after that. But then we saw Egypt in need for vaccines, so United Arab Emirates government took the liberty and sent vaccines to the Egyptian government. That's on the level of the international borders. But if you think of on the local borders, I used to be with the Ministry of Health before January 24th. And I remember some of my colleagues from Dubai Health Authority used to call me and say, we need, for example, PPEs, we need XYZ medication, and we used to send them. And sometimes we needed from the ministry, we needed from Dubai Health Authority or Department of Health in Abu Dhabi, and we exchanged PPEs, we exchanged medications, we exchanged employees sometimes. We had, during COVID, everything was possible, everything was done. I mean, some of the things, for example, for international collaboration, today if I, feel sick in Dubai, they'll ask me for my insurance. Being a local, the government covers me, that's fine. But if any expats feel sick, they will ask him for his insurance. But during COVID, no one asked for any insurance. And it went absolutely fine, and the government took everything on their burden. So the thing, that's another way of collaboration. Now, I think when I say it happens naturally, because somebody in the system, let's say this conference, for example, when my colleague, the ambassador, heard that we are coming here, he joined us. His knowledge about the IHF is very limited. And maybe he read about it when he heard that there is a conference happening here and a big delegation from United Arab Emirates is coming. So to him, fine, I'll join the people. So himself took the initiative. No one contacted him from the Foreign Affairs Ministry. No one asked him to be here. But he took the initiative, and that's kind of collaboration that I think is where it happens naturally. Because I'm part of the system, I need to be there for them.
Sure. I love what you said about the fact that collaboration happens on so many levels. I mean, it's with investors or corporate partners. I know in the United States during COVID, there were a lot of companies that came to make masks or whatever they could do to support the healthcare systems, and that's very encouraging. But it's also true that I think we learn to work together a lot differently, right? With our workforces, across disciplines, across settings, all of the rules were sort of off. And I think that that's encouraging in one level, not that I would want a pandemic to do that, but because it shifts your whole paradigm about how what we can do together and who's at the table and how we work together. Does it strike you the same way?
Yeah, I think so. I mean, all the health systems and hospitals, the health system shared and face the same challenges. So we have to be able to share knowledge, to share experiences, to exchange better practices, and that's very important. So I think that conferences like this, are very, very important, and also as a way to exchange this knowledge, talent, experiences, and good practices.
Absolutely.
In a natural way.
Let me ask you, if you don't mind, Mr. Awadh, what about the future? Let's think about, leaving our wonderful city of Barcelona. We're in Dubai. What kinds of things should we prioritize, or what kinds of things are you prioritizing where collaboration might benefit even further?
Yeah, I think we should stand next to each other like a football team, a soccer team. were shoulder to shoulder and play as a soccer team in our own different jobs. An example, Dr. Yusuf used to be, and he's still a mate in the industry, but we used to work under one umbrella, and our boss was one. That's December 2020. Today, in the last 10 or 11 months, he's heading a different organization, I'm heading a different organization. But we talk nearly every week, and we think about things that we could do together for our two organizations. Sometimes we do disagree with each other. Sometimes we do compete with each other. But at the end of the day, what I think will remain is what we do together. At the end of the day, the client is one. And whether they go into Dr. Yusuf's hospital or they come to our hospital, they should receive the same service seamlessly. I think there is an example that we took actually one of the systems from the establishment, and it's working beautifully in Dubai Health Authority right now. Mm-hmm. Yeah. I know he's planning to take some of our doctors, but I'm against that. we'll talk later with him about this.
Talk later. Yeah. That's so good. What about your plans for the future? Are there certain kinds of things you want to learn more about, or things you wish you could discover perhaps from other people?
Well, there are a lot of things to learn. I mean, you are learning every day from everybody. So we have to always keep our mind open, just to, and this global forum, such as this Ihf Congress, is really a very good place just to share, as I said before, to share experiences and to share talent and to meet people, to meet organizations. So it's a very special kind of forum.
Yeah, we're very much believe in that too, right? The poster sessions, the number of sessions. I think we had 60 sessions here. 71 countries. That's an amazing type of collaboration. Go ahead.
Absolutely. Sorry. No.
I thought you meant.
No, I was thinking that maybe in Dubai there will be less sessions. As you said before, less than 60.
Maybe
yes,
less
absolutely,
sessions.
yes.
But a lot of networking, and perhaps networking of all different kinds of dimensions. This idea of coordinating and working together across boundaries, but also across lines. What are the other things? We've only got a few minutes left. What are the other things that really are top of mind for you as the Minister of Catalan? What are you going to? What's sort of your top challenge, and what are you thinking about?
Well, I think that our top challenge now is the integration of social and healthcare. I mean, we have an age population, very dependent, as happens in all Europe. And I think that now we have to integrate this social and healthcare. Otherwise, people will not be cared in a proper way.
Yes, that's a big problem also in the United States. That and workforce. Everybody wants to talk about workforce and the problems with resiliency and the mental health. These issues around burnout, and everybody's tired, to your point. And how do we reinstill that energy and commitment and make sure we're taking care of them? Can't take care of our patients if we don't take care of them. How about for you? What is sort of your top challenge? If you could solve one problem, what would it be?
I think, and I believe actually in this, I think everyone is responsible for his or her own health. And if we don't command it from day one in the right way, we end up in a hospital. Mm-hmm. So education to these people, whether, in the health industry or non-health industry, education to tell them and that they should lead a healthy, well-being life is better than, letting them do whatever they want and then ending up in a very bad critical situations. So I think education is the most important thing for us.
Yeah. I would think that would be the case too. I know that obviously there's just a lot of issues that need to be solved, and we need different paradigms. We have a sick care system. We need to get on the front end of the problem, spend more time on prevention and keeping people healthy instead of being in the sick care business, right?
There are many health systems, but only one health. And this is something that we have to keep in mind.
Yeah.
Many different health systems, just one health. And if you allow me to mention another challenge, is sustainability. I mean, I think it's sustainability. Sorry.
Yeah. No,
I think that you make a better pronunciation than me.
No. No, sustainability is probably true for you as well, right?
Absolutely.
Yeah.
Absolutely,
yeah.
yes.
Well, I know I'm looking forward to Dubai. What's the one thing you're looking forward to at IHF next year?
Oh, to be in Dubai and to have less sessions in here and less work in here.
Yeah.
Just it's the job.
And you will be very busy next year. What are you looking forward to, Your Excellency?
First of all, I'm not going to be busy.
Yeah.
Oh.
They are going to be busy. Where are they? Raise your hands.
Well, then I would suggest we give those people a round of applause.
So they will be busy, busy in organizing the event the way that they like to organize it. And I'll be supporting them in whatever decision they take.
Yeah. It's a wonderful thing. We have really enjoyed our time. I know I have enjoyed my time with you. The city is amazing. We're looking forward to Dubai. We're going to do the official handoff sort of next. I'm sure you're going to take a vacation, although you probably can't do that.
Can't.
And you're going to put the team to work. We know that. But again, let me turn things back to Helena, who is going to sort of shepherd us to our next chapter up here.
Thank you very much, Deborah.
Thank you so much.
Thank you. Thank you, Honorable Dr. José María Argimon. Thank you very much, His Excellency Awadh Ketbi. That was a fantastic session, so a big round of applause for all of them. Thank you. And yes, as Deborah said, it's now time to move on this closing ceremony. First of all, we will announce the winners of the Best Poster Awards. This year, we have more than 200 posters showcasing impressive projects and initiatives under 3 sub-themes: digital and technology-driven transformations, value-driven transformations, and people at the center of healthcare system transformations. So, first of all, thank you to all of you for all the posters presented. We encourage you to continue promoting good practices and innovation in health service delivery. Our judges did an impressive job of reviewing the top posters to select the best of the best. Our sincere appreciation goes to our esteemed panel of judges. They are Dr. Robin Beckley, Connie Ivashik, Ilaria Janiko, Roger Jakab, Kyung Eun Lee, Dr. Hamid Ravaji, Dr. Ana Riera, Josep Tabernero, and Professor Antoni Trilla. Thank you very much to all of the judges. A big applause for all of them. Thank you. And let me welcome here on stage, please, Dr. Ana Riera. She's Head of International Affairs at La Unió Catalana d'Hospitals and one of the judges So please come on stage. Welcome. She will help me to present and give all the awards. Thank you. Let's begin with the first theme, digital and technology-driven transformation transformations. The bronzer winner is establishment of peer review system in Tokoshukai Group hospitals in Japan. 3 years results. So congratulations to Hidemitsu Nakagawa, who is joining us virtually right now. A big applause to all of them. The silver winner is budget impact of replacing hospital inpatient care with virtual care. We invite Guido Peters from Ring State Hospital to join here on stage. Congratulations. And the gold winner goes to adherence evaluation to the recovery process after a total knee astroplegic intervention using a telerehabilitation platform. We invite Montse Nuevo from Hospital Clínic de Barcelona to join here on stage. Congratulations too. Please, if you don't mind, wait here both to take this family photo. If you can just maybe come here for a family photo for all of you. That's great. And a big applause to all of them. Thank you. This way. Thank you. And now, let's continue with the best posters of the value-driven transformation. The bronze winner is Club Benchmarking La Unió, lessons learned from an experience of 15 years identifying healthcare providers' best practices from the comparison. Congratulations to Pere Pascal Riera, who is joining us virtually. Congratulations. The silver winner is the Results Center of the Catalan healthcare system, a tool for transparency, benchmarking, and healthcare quality improvement. Congratulations to... Well, no, it's okay, it's okay. This was to Ana Garcia Altes, who is joining us virtually too. So congratulations, Ana Garcia Altes. No worries, you can stay here for the next. Because the gold winner is analysis of the potentially inappropriate medication prescribed to elderly patients in integrated outpatient care service. Congratulations to Lee Chin Shih to join us virtually. A big applause. Thank you. And now, in the final category, the best posters of the people at the center of healthcare system transformation. In this case, the bronze winner is the challenge of person-centered care as a professional competence healthcare immunizations. These congratulations are to Giselle Fontanet, who is joining us virtually too. Next is yours, I think. The silver winner is the Adjusted Morbidity Groups, a new stratification tool for risk assessment. We invite Damien Valero-Bouvet from Catalan Health Service to join on stage. And the gold winner is Empowering Human Resources Management with AI. We invite Jose Munuera from Amalfi Analytics to join on stage. Thank you. Let me check. Yeah, Empower. Yeah, Jose Munuera, this is yours. So welcome on stage. Congratulations and thank you. The Gold Award is for you in this category. Let's just take this poster for the family photo. And thank you very much. Congratulations to all the winners. All 3 gold winners will receive a complimentary registration to the World Hospital Congress in Dubai next year. So enjoy it and enjoy the other 2 winners. Thank you very much. A big round of applause to all of you. Thank you. You can go this way, please. Well, now it's your turn. I'm delighted to welcome to the podium Dr. Ana Riera, this time to provide these closing remarks. So whenever you want, the audience is yours.
Thank you. Thank you very much. Good afternoon. Bona tarda. Salam alaikum. Honorable Conseller de Salut, Dr. Josep Maria Argimon, His Excellency Awadh Al-Ketbi, Director General of the Dubai Health Authority, authorities, friends, participants, on-site and virtually, ladies and gentlemen. I believe that we can easily say that as we wrap up this long-awaited Congress, it in fact has been too short. We had to overcome many challenges to be here today, principally the pandemic, which, in spite of everything, has taught us many things which we have been witness to and enjoyed during these last 4 days of the Congress. So, what we have learned? For us, most importantly, and more than ever after the COVID-19 pandemic, we have learned that collaboration is key in order to advance, to transform our services, and to give the most adequate response in face of people's needs. Now, we know that this is not just a slogan, but a reality that we must brave and the only way to advance towards a brighter, better future. What we have learned? New leading models, to put in place gender balance in hope that we don't need to talk about this anymore and to talk about people, that the health system's resiliency is based on being prepared and to keep in mind how we respond to the future uncertainties. Who would have known that we would experience a pandemic? Who can predict what is to come tomorrow? We have learned that we must be prepared for situations we cannot always anticipate. We have learned that the healthcare workers' role is of utmost importance to provide efficient and first-hand services, that the research done to overcome this situation has made us stronger and quicker than before solving people's needs, that technology in the services of patient care gives us many opportunities without dehumanizing healthcare. On the contrary, it allows us to have more time to look into our patients' eyes and actually take the time to listen to them. As well, that increases safety and adds precision to procedures. That the healthcare sector has ways of contributing to minimizing the negative impact on climate change, while facing health problems it produces in people. That trust and transparency is of utmost importance. The different sessions have given us the chance to learn about projects and initiatives from around the globe, and by doing so, we have learned how health professionals, decision makers, policy makers, and other professionals are working hand in hand to coordinate and maximize their potential to give response and solutions to society's needs. I will never have enough words to show my appreciation for the work they done every day. I had the chance to read an anthropological study not too long ago that argued that the fact that globalization, in all its doings, homogenizes behaviors, which in turn is a grave error mankind is committing. Diversity and the contribution that results from diversity towards the community is the answer. This idea is something that this Congress has demonstrated and taught us. At a local level, each professional, each country has had the opportunity to articulate the best answers to our global issues. And this is precisely what has happened these few last days. In Wagensberg's words, diversity is beautiful, respectful, and ethically positive and contributes to richness of our common well-being, resulting in the best possible community. We also believe that this Congress has been a success regarding attendance, given the circumstances, and that it has been successful for different reasons. We have shared knowledge, experiences, best practice from around the globe. I am convinced that we will all leave here today wiser than we arrived. We have proven that collaboration accelerates transformation within healthcare organizations of all kinds, professionals expressed from different areas, business and citizens, all key players in making this world a better place to live. We have been able to meet, to get to know each other better, and that in return is the base of respect and tolerance which allows us to advance in a more coherent and solid manner. Thank you for having waited so long, for having come, for those that have been able to come, but also for those joining us virtually, for those that have been forced to stay in your places, and for not having failed in collaborating and sharing your knowledge, experience, and lessons learned through your journeys. Now is it in our hands to put all these lessons into action and continue to work hard. From Barcelona, we are committed to continue working for healthcare systems that have the capacity to be responsive, resilient, and agile. Our young executive leaders have worked to set the path, and we are committed to identifying, sharing, and giving all our support to the best possible practices we can. We pledge to elaborate a statement from Barcelona Congress that gathers all the lessons learned and the will of all professionals present today to create a base camp towards a better future. Global gatherings like us are not the end of the line. On the contrary, they are a simple stop in the path towards an onmoving innovation train, on which the witness, knowledge, learning, and unlearning processes get off and on. That said, we will continue until our next stop, Dubai's 45th Congress in 2022. Thank you very much for your generosity that forces us to continue to move onward. Thank you very much.
Thank you very much. Thank you, Dr. Riera, for your nice words. I think this is for you. Anna? You will need it, for sure. Thank you. Well, the 44th World Hospital Congress come to its end. And I'm sure that we are all agree that la Unió Catalana d'Hospitals did a fantastic job by co-hosting the first ever hybrid IHF World Hospital Congress. With all our appreciation and thanks, it's time for us to bid farewell to the 44th Congress host and to extend a warm welcome greeting to our next host for the next year. So I'd like to invite now here on stage Mr. Enric Mangas and Ms. Roser Fernández, President and CEO of la Unió Catalana d'Hospitals. And joining them, please, if you don't mind coming up here on stage, I'd like to invite His Excellency Awadh Al-Ketbi, Director General of the Dubai Health Authority, the host of the 2022 World Hospital Congress, and joining him, please, if you can come up on stage, His Excellency Dr. Josep Mohammad Al-Serkal, Director General of Emirates Health Services, and His Excellency Mr. Mahid Al-Suaidi, Ambassador of the United Arab Emirates. Thank you very much for coming here on stage. The token given to Dubai Health Authority is a decorative sculpture, as you can see here in their hands, of Barcelona's skyline. It is handmade from oxidized iron, a warm, vivid, and unique material, symbolizing longevity and persistence. It has an engraving that reads, "Barcelona is proud to hand over the World Hospital Congress 2022 to Dubai." So whenever you want. Yes, the level is very high, but for sure you will do a very, very good job next 45th edition. Thank you very much and congratulations to all of you. Thank you. If you want to take these stairs to go down and take your first row seats. And well, for a first preview of what's to come next year, right now you can join me in watching this special video.
Assalamu alaikum. Good afternoon. On behalf of the government of Dubai and the Dubai Health Authority, I would like to take this opportunity to invite you to the 45th IHF Congress, which will take place in Dubai from the November 9th to 11th, 2022. The conference will be held at the Dubai World Trade Center, a venue where several esteemed international congresses have taken place. IHF is a special congress as we are hosting this congress for the second time. Dubai is a city where more than 200 nationalities live and work. We also have a wealth of experience in hosting successful congresses. We are currently hosting the prestigious World Expo 2020. Grateful to welcome you to Dubai, United Arab Emirates, and look forward to your participation in the 45th IHF Congress. Thank you.
From the United Arab Emirates, the country of prosperity, goodness, and peace, and from the heart of the world, the city of Dubai. The story began in the sands of a vast desert and the neighing of horses traveling through time into the future. The race started with the clock, and Dubai started chasing its dreams. Dubai set new rules for progress and wrote a distinctive title for luxury. And with the latest infrastructure networks and technology, and with the tremendous development in all aspects of life, Dubai has become the home of opportunity and a source of happiness. It has become the preferred destination for world summits, conferences, and exhibitions. It is the first choice for meetings for doctors, scientists, experts, and artists. And it has succeeded in tackling the COVID-19 pandemic with its advanced health system. Dubai, from the land of the Emirates, has succeeded in hosting and organizing Expo 2020. Dubai is waiting for you. Welcome to Dubai.
Excellencies, distinguished guests, ladies and gentlemen, it is indeed an honor and a great pleasure to welcome you all to the United Arab Emirates and express our immense pride in hosting the 45th edition of the International Hospital Federation World Hospital Congress 2022. Such an important event that brings together leaders and decision makers from across the globe. Ladies and gentlemen, the World Hospital Congress represents a golden opportunity to discuss national and international health policies, solutions, and trends, and provides an exceptional platform to look at the international best practices in management and service delivery. With that being said, we affirm our commitment to harnessing all our capabilities and resources to bring such a prestigious event into a success. looking forward through this leading platform to supporting members' efforts, exchanging expertise, and adopting forward-looking innovation and sustainability-based agendas, especially when it comes to developing hospital strategies and operational plan, according to international best practices. Thank you.
Bismillah ar-Rahman ar-Rahim. As IHF Special Advisor for the Middle East region, I would like to invite you all to the 45th edition International Hospital Federation World Congress, which will be held between 9 to 11 November 2022, which will be in Dubai World Trade Center. And this is a very important event for us because we are hosting this event for the second time in Dubai, United Arab Emirates. And it will be a memorable experience for all of you and all of us to get together, to exchange our knowledge, to bring the latest technology, information about healthcare, and adding a lot of value for the healthcare providers and professionals. So be part of this event and see you in Dubai, United Arab Emirates. Thank you very much.
Well, you saw it. Night to take your calendars and mark it, November from 9 to 11 on 2022, and in Dubai. We will meet you there. So, well, with the ceremonial handover to Dubai, all that's left to do is officially close this year's Congress. For some final words, I invite back here on stage Deborah Bowen, incoming President of the International Hospitality Federation, to share her closing remarks. Thank you, Deborah.
Thank you very much. So probably the last thing you want to hear is another speech. So I prepared an hour-long lecture for you. I hope that's okay. And Ron is going to go back and open the cava or something to celebrate this very special moment. So obviously, I want to thank our hosts again. It's been an amazing time in Barcelona. I think not only our first foray into a face-to-face virtual meeting, and it's been absolutely wonderful and beautiful. And again, I want to thank you. It's this is sort of my first official duty as president, and so obviously I'm a little sort of anxious about it all, but I am so looking forward to working not only with Dr. Muna, but also the governing council members, with Ron and the incredible IHF team. Thank you all for doing what you do for us. And I'm very excited about the opportunity before us. Hopefully you've come away from this meeting not only thinking about something new you can do or someone you met along the way that you can collaborate with, but also, I think we've been reminded about the humanity of our work and how closely knit we really all are, even in disaster and crisis, and how we're going to use that to move forward, to help our workforce, to help make sustainable organizations, to really advance health and really leverage the opportunity of discovery. So, IHF is a great forum. I hope you will agree with that. And again, I'm really looking forward to Dubai. I'm looking forward to building on these relationships. And again, you know, I'm not really in the habit of quoting, particularly as of late, American presidents. But John F. K. did say, leadership and learning go hand in hand. And I absolutely agree with that. I know all of you do as well. I want to thank you for all the work that you do every single day back home, probably without accolades or anything else. I am grateful for you. I celebrate you, and I look forward to seeing you in Dubai. I think let's also thank Helena. Has Helena been amazing all week? You've been absolutely wonderful, keeping us on task, keeping us on time. And I think our meeting is officially closed. Is that what I'm supposed to do? Something official like that? Again, safe travels to all of you. Be well, be safe. Thank you.
Thank you. Thank you, Deborah. Thank you, President. And, well, thank you once more to everyone for joining us online or here, face-to-face. We look forward to seeing you again, online or in person, next edition in Dubai. So take care. Thank you very much, and see you soon. Bye.